better survival in is achievable through their hands with focus on paying tribute to patients, families, and medical teams, healthcare providers, and positive impact they have on the lives of children and adolescents with cancer and other issues. Now, according to the World Health Organization (WHO), each year, an estimated 400,000 children and adolescents from age 0 to 19 years old develop cancer. Approximately 1.1 million new cancer cases occur each year in Africa, with both with about 700,000 deaths said to be recorded. Now, the data estimates show a considerable increase in cancer mortality to nearly 1 million deaths per year, that it could get to that by 2030 if urgent and bold interventions are not initiated. Now, in high income countries, Western countries, more than 80% of children with cancer are cured. But bring it down to low, medium income countries where we fall under along the way or even below, less than 30% are cured. Now, today I've got some special guests who are in the field, medicine, who would be breaking some of these issues around cancer, childhood cancer for us this morning. First, I want to make welcome Dr. Adeola Maliki, medical officer in oncology, medical research volunteer. Good morning to you.
Good morning. Thank you for having me.
And of course, we've got also from the Dorcas Cancer Foundation and Korede Akindele, the head of programs, the Dorcas Cancer Foundation. Good morning to you.
Good morning. Thank you.
So let's get into the conversation, gentlemen. Childhood cancer. Until this morning, for some persons, they would not have understood what it means until some of these statistics are coming forward, or it may look so strange, or it may be something spiritual when they look at it. So I'd like us to first approach this issue by breaking it down. What when we say childhood cancer, what exactly are we talking about? Let's start with Maliki.
So childhood cancer, basically, as it implies, it's cancer in children. People erroneously think that cancer is a disease of the elderly because usually cancer occurs as you grow in age. But due to some genetic variations and some certain factors, children do have cancer. Children as young as 6 months and even 1 year could have cancer, receive treatment for cancer. So yes, it's something that happens rapidly. We don't have the exact numbers. Like you said, WHO says about 400,000 worldwide, but we don't have the exact numbers for us here in Nigeria. But we do see a lot of children with cancers, from brain cancers to cancers of the kidneys, cancers of the blood, cancers of the bones. So yeah, it's something that does happen. Cancer does occur in children, even as young as 1 year old, and it's something that we need to keep talking about.
So that takes me to Dr. Korede at this moment. Let's see, when we say cancer, childhood cancers, so exactly at what point it means parents now should begin to think about their children and watch out. So let's look at some of those symptoms that you would begin to look out for and say, okay, is it time to probably get to see a medical doctor? And let's explore that area and then we go into causes.
Okay, thank you very much for that question. So, unlike adult cancer, childhood cancer does not present itself like an adult cancer. For example, if you want to talk about cancer in a woman, maybe a breast cancer, you would say, okay, just check your lump in your breast. But for childhood cancer, it doesn't present itself like that. It comes like every normal sickness in a child. But there is no particular cause of it. But what we just try and tell people is it presents itself like an enormous illness in a child. But one of the way you can know something is wrong is when a child is having a repeated illness, and then you're trying to treat a child for maybe a particular, maybe malaria or typhoid, and something is not going, or a repeated infection. It requires you as a parent to pay a close attention to a child's health. So you cannot, it's not like an adult cancer when you say, you know what, when a child gets to this particular age, okay, go and do a screening. No, there's nothing for that about childhood cancer, but it's something that occurs. And what you need to do is pay attention to your child's health. If you notice a growth that is abnormal, it calls for attention. If you notice a repeated illness that you've been treating the child for a particular illness is not going, for example, let's say infection, which normally comes with blood cancer, which is leukemia, and then you've been going in and out of us because we've seen cases whereby people will say, you know what, I've treated a child on malaria for 6 months, and it's later I was discovered I was told it was cancer. So as a parent, pay attention to your child's health. You know your child very well. Children does not pretend. And if you see something abnormal, request for a specialist who is a pediatrician. I mean, that's why we advise people to always see pediatrician when a child is sick. But we know everybody cannot actually see it because of the kind of society we are.
Okay, so this also I was going to mention as if elementary knowledge back in the days in biology would tell you that, and that's because you also alluded to it now. So I'd like us to explore that area. So parents would let's break it down to that point. When we talk about cancer, as he alluded, he said it is simply the what you call abnormal growth. So take us through that types of cancers.
Um, Cancer basically means that the basic unit of life basically in the body are the cells, and then these cells multiply, they grow under the body's regulation. But in cancer, they grow beyond the body's control, and then they grow abnormally. And this can happen anywhere in the kidneys, and the blood, in the brain, in the bones. The most common one in childhood cancers is leukemia, and this affects the cells, particularly the white cells. These are the things in the body that help you fight infection. So, like you said, the symptoms sometimes are non-specific. So the symptoms are specific to the area where they're affecting. In children, they can't really complain, they can't really voice out specific symptoms. But frequent illnesses, so when you're treating malaria all the time and it doesn't seem to go away, or there's an abnormal growth, abnormal swelling anywhere, in cases of like the kidney cancer, Wilms tumor, sometimes it goes as severe as a child peeing blood, or a child just crying unconsolably, a child not eating as much as he wants to or as much as he used to, an abnormal limp, abnormal walking gait, all of these things, because they are non-specific, we have to tell parents to have a high index of suspicion when it comes to these things. Not all symptoms are cancer, yes, but present to the health workers, present to the doctors. They would know how to screen against that, how to test for it, and who to refer you to. Ultimately, the pediatric oncologist when it comes to cancer care.
Okay, thanks, Dr. Malik, for opening that up a bit for us. And that leads us to if it becomes abnormal, this leads me to raise concern about the child at this moment. I'd like you to talk to me about, and the listener, about the implication for the physical development of a child. And so, Dr. Korede, you want to speak to that?
Okay, the physical development of the child. I mean, for example, if a child is having cancer and is going through the treatment phase, definitely there will be a toll on the body of the child. The child might not grow the way other children are growing. I mean, for example, if he's going through chemotherapy, there will be a side effect of it in the body of the child. Which you see sometimes the child will be lame, or sometimes the child will lose his hair. I mean, there is that factor that affect the child, but that does not stop the child from still achieving greatness or do whatever he or she wants to do in life. There might be a slow progression in the course of doing the treatment, maybe sometimes 2-3 years, depends on the treatment lag and everything. There might be a slow progression, but definitely there will be a toll on the body. And there are some, for example, maybe like leukemia, ALA that he talks about. It might not even, I mean, showing the child body that you see, what this child might be looking fine, but something is in the body. So definitely when something abnormal is in your body, it will definitely show that, okay, things are wrong, and when the child is going through treatment, that season will come, but it's something that will be overcome.
Okay, you want to add, Dr. Malik, add
Yes.
something to that?
So in addition to what he has said, the child is, it, any child is growing. You need nutrients, you need calories, you need special time and attention for a child to grow well and to grow normally, like you said. Any illness affects this, especially cancer. It affects how their body processes nutrients. The treatment itself, like he has said, chemotherapy, even surgery, affects how you eat, takes time away from your usual development, playing with your brothers, playing with your siblings, going to school. So yes, it does affect the child, both physically, emotionally, psychologically. And then it's the theme for this month, better survival, is speaking to this. While we are attacking the cancer itself and the physical treatment, we also need to pay attention to the psychological and psychosocial management as well when it comes to survivorship beyond treatment, reintegrating back to school, reintegrating back into the family, even for the caregivers as well. It's something that we need to pay attention to.
Can we save that aspect, the psychosocial, as we explore later? We'll come
Okay.
to that, but
Okay.
there are issues. But before we get into developments in terms of medical breakthroughs and to give hope to people listening at this, I like us to look at. There's this that you mentioned now that you can't really point to a fact. This is what causes it. But have we? Can we explore external factors like lifestyle of parents to see if it has a direct bearing, to trigger cancer in children?
Yes, like I said, there's no one cause that you can lay your hands on, but there are some risk factors, especially and it all starts from even before the child is conceived, before pregnancy is even has happened. We talk about folic acid supplementation in women even before they get pregnant. All of this affects how the body's genetics or how the genes are controlled. Cancer, why we can't lay our hands on the causes, we can lay our hands on some genetic aberrations or some genetic alterations, and then your diet, um, things like smoking cigarettes or using illicit drugs or taking alcohol during pregnancy, exposing the child to undue radiation, when it comes to maybe x-rays or even telecommunication masts have been implicated in all of this. So there's no one cause that we can lay our hands on, but there are some things that we can do to live better, healthier lives, basically. Nutritional supplements, not smoking, not drinking, not taking alcohol, especially during pregnancy or even in the young, and when the child is in the young stage, you want to avoid all of these things.
Dr. Malik and Dr. Korede, I ask you to just please hold on. We are at the red light. When we come back, we get into some more discussions as it relates to childhood cancer prevention and cure. And you're listening to Smooth 98.1 FM. Stay tuned.
Love life. What does future forward banking mean to you? Speed, innovation, convenience, lifestyle goals, or just simply getting service that is designed just for you? Yeah, we thought you might like all of that and more. That is why we specially created Providus Bank for you to take care of your daily experiences. At Providus Bank, we believe that banking should be all about you and your business and how to get you to the next level. If you do not already have a Providus Bank account, please speak with our business concierge on 0700 77 684 387 or email businessconcierge@providusbank.com to switch to a future forward banking experience. Providus Bank. Future forward banking.
Hi, this is Gold Swagger on Smooth 98.1 Radio, the smoothest dial on Lagos Radio.
Why don't you stay?
Providus Bank. Future forward banking.
We're Smooth 98.1 FM. It's gone 17 minutes already past the hour of 9 o'clock. You're on to Lagos Talks 981. My guest still here, and I've got Dr. Maliki here with me alongside Dr. Korede Akindele this morning as we look at childhood cancer prevention and cure, and it's all related to marking the Childhood Cancer Day in September. So far, we've been able to establish the fact that we do not know what causes cancer in children. It is also, before we went on the break, we talked about it. You can't really place a hand on it. It just seemed like you just have to keep guessing for now because of research is still ongoing. But for some instance, you could look at lifestyle to say, could it be lifestyle from parents, exposure to environmental factors? So far, we've agreed on this one. Like you mentioned, radiation. You talked about smoking, for example, exposing alcohol and all of those for now. So we've agreed on that. Let's get into this other aspect of when parents now move from knowing that this is cancer. I'd like you to speak to the fact that it just seemed like a death sentence. Helplessness. Let's before we begin to tell them let's move on with treatment, can we begin to look at is there hope medically? Speak to that, Dr. Maliki.
Thank you very much. So like you said, in the Western climes, cure rates for cancer as high as 80-90%. So yes, there is hope. And the key thing here is early detection. That's one thing that hedges the chances of better survival and better curative rates. Early detection. Once the symptoms are noticed early and it is caught early, and you get to the right doctors early, curative rates are as high as 90%. We don't have all the facilities and all the treatment modalities present or easily accessible here. To better put, easily accessible here in our country, but there are so many treatment options, so many treatment modalities, and so many things that can be done when cancer is diagnosed. So yes, it is not a death sentence in any way. As long as it is caught early, you present early, you meet the right doctors early, and well, yes, with good financing, because I mean, like our seeking good healthcare is costly. We pay out of pocket here. So when it's caught early, you meet the right doctors early, and then with good financing, yes, curative rates are as high as 90%.
Okay,
Before you chip in, let's just make sure that the listener know they can be part of this conversation at this point because we've established all of the foundation for them to be part of the conversation. So they can come on the phone line. 014489981 will be the number for you to give us a call on the line. 014489981. We also would love to read the WhatsApp messages if you can get the call across on 0809444091. Yes, you were going to add something.
So it was in my mind when you mentioned hope. And I just want to say, if you receive this diagnosis, it's not a death sentence. Because sometimes when you go through the counseling, it might be, okay, you know what, it's a 50-50 drive, we just need to go. But for any born family going through this, it's not a death sentence. The good news, like Doctor said, is there are chances of survival because children are reproducing. So you mentioned death sentence the other time, so it's ringing in my mind to say, look, it's not a death sentence. We have seen survivors. We have seen stage 4 that has come out of it, and they are doing fine now. So so when you receive this news, just allow the doctor to walk through with you.
Now, so I'll still stay with you, Korede, on this one. I'd like you to talk us through some of the types of childhood cancers you've diagnosed in the field in practice, and then help us understand it, and then from there we'll begin to look at modern discoveries and innovations and development in the field of medicine to help children at this time. So
okay, thank you very much. So I want to talk basically based on what we see around here in Nigeria and in sub-Saharan Africa. For example, like you said, leukemia is one of the common cancers in children. That's the cancer of the white blood cell, like you said. And then we also have Wilms tumor, which is also known as nephroblastoma. That's Wilms tumor. It's a partner of the kidney. It affects the children in the kidney. We have the retinoblastoma, which is the cancer of the eye. It affects the child in the eye. We have brain cancer, which is one of the common cancers, brain tumor, brain cancers. And we also have lymphoma, which is the cancer of the lymph node. So these are common ones that we see. Now, there are other types around, but for us in this area, lymphomas, leukemias, Wilms tumors, these are the common that we see around us, and these are and then that we have more survival, but doesn't display that there's no other cancers that happens for children. But these are the common ones that happen, and these are the ones, like you said, parent pay attention to their child. Notice a growth, notice a mass, notice a child is not eating well. Something might be wrong with the kidney, and it's better to be sure that it's not cancer than to say, you know what, this is it.
Dr. Malik, let's delve into local, international breakthroughs in these areas, because it's all about raising awareness for hope in terms of pediatric cancer. So speak to all of this for us.
Yes, the three major treatment modalities when it comes to cancers are either surgery, some form of chemotherapy, or radiation therapy. We've always been able to do surgeries, but there are always better techniques. There are better facilities, more hospitals coming in, specialists to do these surgeries. When it comes to chemotherapy, we have facilities that can give and safely give chemotherapy to children. More specialists are coming up in administration of chemotherapy. But what I can speak to now is radiation therapy. Like the new cancer center in Luth, they are doing wonderful work there when it comes to radiation therapy. They have a linear accelerator, halcyon machines that can give specific direct radiotherapy to the specific parts, especially when it comes to children, with fewer side effects. Also, there are other treatments when it comes to new techniques like immunotherapy, targeted therapies. We didn't usually have this as easily accessible in the country, but now we have facilities, we have pharmaceutical industries that are able to procure this for us. And then so there's a lot of hope. Especially in cases where they present late or there's a chance of recurrence or it has spread elsewhere. There are many things that can be done when it comes to this. People usually, when they have this diagnosis, some people don't have that much faith in the healthcare system here and they would want to travel. And then I tell them that, you get basically the same care here that you will get abroad, especially when it comes to the specialists involved, when it comes to the equipment and the machineries. So yes, there are a lot of new things happening, a lot of new exciting things when it comes to cancer treatment and cancer care, especially in pediatric cases. So there's a lot of hope and a lot of new things happening.
Dr. Korede, this one for me is there's now you talk about new developments in the field of medicine that would make it not be death sentence for a child who must live out the true essence of their being and fulfill it. But there is a fear, even with adult cancer, and as well now being transmitted to that same fear being passed on to treatment for childhood cancer, saying with cancer, it seems like even no matter the treatment, there is bound to be what you call a recurrence. So I'd like you to allay that fear. And why, if really we've done the treatment, why would we have cases of it resurging all over again?
Okay, thank you so much. I think it's called relapse most times, and see, it comes not as a result, not because okay something was not done properly before. Sometimes there are chances that the child could have second cancer, and then I mean we have a child who has that. Timothy, he has a relapse, a second cancer, but now Timothy could walk through the journey and is back to school. He's in an institution now. He's a survivor already. And so there are chances that okay there can be a relapse. There are chances that okay there can be a second cancer as a result of the growth and the genetics in the body. There are chances, but medicine keeps improving. Yeah, like you said, unlike in the developed world where there is 80% chances, we still struggling with 30%. But what we are trying as much as possible to, so that's why the place of education is very, very important for the healthcare workers, especially the professionals working with childhood cancer in Nigeria. And I mean, we all know, I mean, people want to live out the country and then go and develop this, but that's why we encourage these professionals in Nigeria on education so that at least you can meet with the standard of the developed world standard. Yes, equipment is coming in. Yes, more chemotherapy facilities are coming in. Yes, more new treatment protocols are emerging globally. And so to tackle these, so there are chances that there can be a recurrence cancer, which is but the chances of the treatment and survival is there with a keep understanding, and that's why education for us it's so key for healthcare workers, and there are platforms, there are avenues in Nigeria here that every specialist dealing with cancer, especially in children or any specialist that is interested in it, can have access to this understanding. Either you are from the locator, which is the primary healthcare, because these ones are the key, when it comes to early detection and survival of cancer. And so from them to the specialist, the pediatric oncologist, the radiation oncologist. So there are chances, but the good news is there are developments on ground that could help our professionals manage these cases and then we cannot have a better result.
Dr. Adeola, Maliki, you want to add something? You want to add some more to what he said?
Yes. So the chances of recurrence or relapse usually most times depend on the particular type and specific type of cancer. How cancer is diagnosed is that a sample is taken from where you suspect, and something called histology is done. There are other tests you do to check the specific type, specific character of the cancer, and there are cancers that are more aggressive than others. So that's why it's always good to go to the right place and the right doctors, get the right treatment, and then the right assessment initially, because all these chances would have been laid out in front of you from the beginning. If we think it's an aggressive cancer with a higher chance of recurrence, we have prepared for it from the beginning. The treatment follows that particular regimen. There are many other treatment options that are available if this happens. So it's also speaks to why you should go to the right people, go to the right place, and get the right treatment.
All right, if you just joined in, you're on to Smooth 98.1 FM and you're listening to Lagos Talks 981. And I'm speaking with two medical experts here. And today they join me to shed more understanding onto childhood cancer detection, prevention, and cure as it relates to Nigeria, giving hope and raising more survivors in terms of giving care. Just got barely a minute before we hit the red light once again. So let's see if we get a message in on 0144. Okay, we get a call in there. That's a call. If we get a call onto the number 014489981, we'll get a call in before we go for this red light stop. Or get a message in also on 0809444091. I will look forward to getting those messages in, but maybe the issues are really sober, and so people will need to begin to take time out to look at this. But availability of centers, places, treatment centers in Nigeria is another issue we have to look at when we come back from this red light stop. Stay tuned. You're on to Smooth 98.1 FM.
Future forward banking. What does future forward banking mean to you? Speed, innovation, convenience, lifestyle goals, or just simply getting service that is designed just for you? Yeah, we thought you might like all of that and more. That is why we specially created Providus Bank for you to take care of your daily experiences. At Providus Bank, we believe that banking should be all about you and your business and how to get you to the next level. If you do not already have a Providus Bank account, please speak with our business concierge on 0700 77 684 387 or email businessconcierge@providusbank.com to switch to a future forward banking experience. Providus Bank. Future forward banking.
We're back in less than a minute.
Always fresh. Weekday mornings on Smooth 98.1.
So we're good. We're Smooth 98.1 FM. It's going 29 minutes before we hit the 10 o'clock mark, and it's still Lagos Talks 981. My guest still very much with me. Dr. Adeola Maliki is here, and Dr. Korede Akindele is also still here with me. So before we went on that quick red light stop, we're going to talk about availability of help in terms of Medicare for cancer survivors or patients in Nigeria. Look at me in the eye, or probably someone listening to you right now. Do we really have how many do we have in this country to give as much hope that you are trying to pass across this morning?
Okay, this like I said, it's a soft spot and a major just touched. The truth is we have less pediatric cancer facility in Nigeria. We don't have as much as we need. We don't have as much as we should have. That's just the truth and the reality of times. Yes, we have a facility here in Lagos, which is in Dut, which is a new facility, which we are glad, and then at least we have money, and then we have in Abuja, but we have less. We need centers that are dedicated, specially for children. I mean, a pediatric cancer facility where they can take their radiation, where they can take their surgery, where they can take their chemotherapy, and for in Nigeria, we have less, which is a challenge. And then because, for example, someone might need to travel from a part of the country to another part of the country to be able to access treatment, which is disheartening, which should not be. But what we try as much as possible is to just keep encouraging and keep advocating for it to governments and to individual who has the capacity, to organizations. And like I used to say, that childhood cancer is a very good investment, because you are investing in a child, in a life of a child. And when you talk to these children, they tell you, I want to be a doctor. They tell you, I want to save more lives too, like the way my life is saving. So imagine if someone does not need to travel from Kamfasha to the city to access treatment before they could get treatment. So imagine if somebody does not need to travel from Ogun State to Lagos State, because before they could have access to radiotherapy treatment. So imagine if we have a pediatric dedicated center. So the same center that adult goes to for radiotherapy is the same center that children do go to. So there is a long list that you have to wait for. So it's challenging and it's demanding. So we have less center, but we just try as much as possible to advocate to government, to individual, to organization, to philanthropies. The childhood cancer, we need dedicated childhood cancer center in Nigeria. We have specialists that can handle it. We have people who have worked in this field a long time, and they can handle it, and we can hold it proper. It's a great investment that anyone can invest in, and then we would all be glad.
Dr. Maliki, this shortage in terms of centers and facilities for treatment for childhood cancer in itself would translate into the costs, isn't it?
Yes, it will. Um, like you said, we have some government centers, yeah, like in Luz and Lassos, and some general hospitals do have some dedicated oncologists, but we don't have pediatric oncologists. The surplus is held with the private centers, but like I said, good healthcare costs money. And then Nigerians pay mostly out of pocket for these treatments, and these treatments can span into millions. Not everybody can, bring out 2-3 million on a whim just to treat and then put it into healthcare. It's sad sometimes to hear that, but like you said, government can help with this. Also private collaborations. In Luth, for example, there's the Alima Ata Pediatric Oncology wards. I think this was a private donation to the wards. The Cancer Center in Luth is a private-public partnership as well. So these are things that can be done if the burden on government is too much. Individuals can come up. Private facilities can also come up. There are also some financial help that people can access, especially at the government hospitals, that can help alleviate some of the financial burden of treatments. But yes, the facilities are not enough, definitely, according to WHO standard for the facilities that we should have, and the specialists, dedicated pediatric specialists that we should have, they are not enough, yes.
So, as we celebrate this International Childhood Cancer Day, I'd like you to speak to some of the programs and events that come around this day.
Okay, thank you very much. So, September, the whole of September is Childhood Cancer Awareness Month, and the color is a gold ribbon.
And that's, I see him having one on, and you also.
Everyone, yeah. So it's a gold ribbon, and it's a sign to show solidarity and support. So, for example, what we're trying to do is we need more voice, we need more hands, we need more people to be part of childhood cancer. October is in a few weeks' time, which is Breast Cancer Awareness Month. You see organizations, I mean, even running tests, running programs, running advocacy awareness for their staffs about pink, everybody wearing pink. We want the same also in childhood cancer. Like we always say, children are gold. Children are amazing. No, there's nothing that you do for a child that the child forgets. And being part of a course like this is a very good course. So you can also wear a gold ribbon. You can we have a collage that we release on our page that you can just put your picture on and put it on your social platform to raise awareness. Okay, so I'm supporting childhood cancer, and you can also support treatment and care of these children. I mean, if you want to report part of the child care, you can also, I mean, reach out and then to do that. So what we just do, you can talk to someone about it. Like what we are here today, we are all always grateful to Smooth FM for doing this with us every year. I'm sure we've been here. This is maybe our fifth year or sixth times that we've been here. Smooth FM has been with us, giving us this platform, and for us, it means a lot to us. And I want to use this opportunity on behalf of the children and the management of the Dorcas Cancer Foundation to say thank you to Smooth FM for giving us your platform every year to raise awareness for childhood cancer. So this is Smooth FM doing their part. Organizations too can do their part. You can put a blue ribbon, a gold ribbon on your staffs. You can put a gold balloon just to show solidarity and to support to save a life. And if you like to know more about it, you can reach out to us. We can guide you on how to be part of it.
And I'd like to speak on that because there was a time there's a center somewhere in Lutz now. You just sandwiched in between one of those high-rise buildings around that. So that's it. So I just look at it and want to ask you to please speak more about what they call the activities of the Dorcas Foundation vis-a-vis all of this is like.
Okay, thank you very much. Okay, the Dorcas Cancer Foundation is a non-profit organization for children with cancer in Nigeria. And coincidentally, this September, we mark our 8 years working in this field. And I would say that 8 years ago, the narration is changing. What we see 8 years ago is different from what we see now. Now, like the center you talked about, which is the pediatric oncology ward in Omatseye in Lut, we are working closely with the center by supporting children on treatment through direct funding of care. And we've worked with over 60 child, and then that is direct that we can talk about. But we have other aids that we can talk about. That's what we are doing, and that's what we do with the hospital. In Lagos here, we work basically with Lut and extend our work to Lasut, and then we extend our work to other parts of the country where we can reach. Yes, we want to do more, but we cannot do more. We just take it at a time because of funding. And another critical thing for us that we do, I talk about education the other time, and which is so important because this is a gap. We've created programs, developmental courses for healthcare workers, and this is not just for professionals alone, to the locator. And this locator, what we are trying to do, at the beginning of this conversation, we talk about symptoms, sign, what do you see? And the truth is, if you ask anyone that their child is sick, have you gone to the hospital? They'll tell you, yes, I went to the hospital. That's the truth. So we go to these locator people and develop their capacity. See, we are not training them to treat because they don't have the capacity to do. And we are not telling them to diagnose because it's and that's why we're always careful to release the information so that you will not see a child on the street and say, oh, yes, cancer, don't cause issues. So we try to say them, when you see these abnormal signs, like I talked about, just refer the child. So we create a proper referral chart according to the WHO standard, which is the WHO Global Initiative for Childhood Cancer. That's where that course is, to develop the capacity of primary healthcare workers. And I'm glad to say we've been able to work with over 2,500 healthcare workers in Nigeria, which are primary healthcare alone in Nigeria, which to develop, and we've seen it. And the good things about this is most times when students come to them, they refer it, and it might not be cancer, it might be another sickness. So it gives the child an opportunity to see a specialist. So we are not just saving only cancer, we are saving other things. That's why that training is so key to us. And then we call it the look again. That's the name of it, look again. So that means look beyond malaria, look beyond typhoid, just look again. And then we also have what we call the PGROC, that is pediatric, this is pediatric radiation oncology virtual course. This is a course for every specialist working in pediatric oncology. It's mainly a radiation oncology courses, whereby we bring in experts because access to knowledge is important in this job. So we try and bring in this international experts to the local experts here and connect with the specialists in the field to train them on specific courses, specific cancer. So we are not just trying to support treatment. We believe education is also important. It talks about the psychosocial which is a key thing, because when you treat a child, who with the family, they have families, and so we create psychosocial program. And cancer is a toll on family. When it affects a child, it's affecting the whole family. And so we create programs that we call caregivers workshop. And this caregivers workshop is created to be able to give this parent going through this journey an opportunity for them to ask questions. Sometimes you might not ask your doctor, but we create this forum. It's a psychological forum where you can ask questions. There is no restriction there. Ask the doctor, doctor, why are you always shouting to me whenever I hear? So the doctor can tell you, doctor, my child, this is straight. It's a caregivers workshop where we created and give parents going through these chances to be able to ask questions, and even individuals outside, general public, to be able to ask what they don't know. So it's a forum. So these are the things, and I'm so glad to let you know that childhood cancer has been added to the National Cancer Control Plan. That gives us a joy. It was not there before. Now it's an attention, and there is a discussion going on globally now to add Nigeria to the WHO GICC.
Dr. Malik, Adeola Malik, we need you to clear this. He just touched on that aspect of psychosocial, which we saved for the last. A survivor, by virtue of the treatment and the care is gotten, now needs to be reintegrated to the family, and then to get back to other activities as a child. We'd like you to speak on that after we come from this break, as we're getting ready to close up the conversation this morning. If you're just joining, I've been speaking with Dr. Adeola Malik, also an oncology, and Dr. Korede Akindele, speaking on detection cancers, childhood cancers, detection and prevention is all the issues we've been looking at this morning. So just stay tuned. You have a chance to call in, to get a call in or two on the number 014489981. Will be there for you when we come back from this break. And also send a message in on 0809444091.
Why? Silky smooth. 98.1.
No, please. This dollar has increased again. How would I change this phone now?
Ever heard of Jumia?
Yeah, but what does that have to do with anything?
So you know about Jumia and you don't know about their brand's festival.
I do, but still, what does that have to do with anything?
Well, you can get quality phones direct from Jumia official stores like Samsung, Xiaomi, Apple, Tecno, and many more at very affordable prices.
Wow, really?
Yes! Get phones, electronics, beauty products, groceries, and many other things from Jumia's official stores at greatly discounted prices from September 4th to September 17th. Jumia, your everyday delivery.
Ladies and gentlemen, I present to you the crown princesses of style and spice. They are a post fabulous. They are reality royalty. Meet the Real Housewives of Lagos season 2. Can you guess who's back? 5 of your favorite housewives return, along with 2 dazzling newcomers. Don't miss this exciting new season. Subscribe from 1,200 Naira monthly. Sign up now at showmax.com.
Come lunchtime on Smooth 98.1, we serve you world music. Travel Africa and the rest of the world as we bring you the smoothest collections of traditional rhythm. It's a rich blend of strings, percussions, wind instruments, and voices. Indulge yourself and go beyond the music.
The greatest activity in music happened during the apartheid era, and great musicians came out of that era.
Discover unique sounds of places, people, and culture, and come alive in your soul. It's a taste of the world on the Casbah, here on Smooth 98.1.
We're back,
Weekday
guys.
afternoons from 1.
Final strike. We're Smooth 98.1 FM. It's gone 13 minutes before it is 10 o'clock, and we are on to the final stretch of Lagos Talks 981. I still got my guest in here, Dr. Adeola Maliki, an oncologist, and of course, Dr. Korede Akindele, still speaking on childhood cancers, detection, prevention, and cure is all what the conversation is all about so far. If you just tuned in, you missed a great deal, because we've looked at the origin, what it could be, the need, what's the next step to go into if you find something strange with your child, And it's also said it's not because if you find it abnormal, it could not also be cancer. And according to Akindele, he's also said that look, there have been cases where parents will come in thinking it is this. No, it's not. They have to refer them back somewhere. But now we're looking at getting to rehabilitate children. How important is this? It must be really traumatic for a child to go through this process. And you talked about the need for what you call psychosocial and all of those aspects. I'd like you to break all of this down and how important to get the children back into the process all over again.
Thank you. So the concept of psychosocial support actually starts from diagnosis. Cancer care is multidisciplinary. It involves a lot of teams, a lot of specialists, and more importantly, the psychologist, the pediatric psychologist. From diagnosis, the diagnosis can be very debilitating when even to the family, not just to the child. Sometimes the child, 2 years, 3 years, doesn't even know what's going on, but then the parents, the siblings, and all of that are affected as well. I'll give an example of a particular family, and then 3-year-old set of twins, and one child was diagnosed with cancer, brain tumor. Now these two kids were really close, and then they always play about and in school together. But one now has to leave school for treatment, and then the brother is wondering why his brother is not with him anymore, doesn't play with him anymore. He's a year ahead of him in class now. Know what's going on. This is where psychosocial support comes in, for not just for the patients or for the parents, but even for the siblings and the family as a whole. He's done with treatment now. He's back in school. His brother is basically 2 years ahead because he needed some time to catch up. The siblings also, attention is taken away from the young children who are growing up, and all of this can affect their, the upbringing, can affect them psychologically. So there's the need for proper psychosocial support, and it's not just something that should be talked about, arbitrarily. Not something that should be a last minute thing. It's something that should be integrated into their treatment and management plan with a proper licensed counselor or psychologist or or psychotherapist to help with this. Religious leaders also help with this as well. Your pastors, imams, and all. And then if there's an important person.
So there is a place for prayer in this treatment.
Oh
is that
yes.
What you're saying?
Oh yes. It affects the psychology of treatment as well. We are a religious country, and it's something. Religion is part of us, and it's part of our culture here. While the doctors do their parts, it is important to be in the right mindset when it comes to treatment, because having been the right mindset has a positive outcome when it comes to treatment outcomes as well. So in whatever means this is for you, Christianity, Islam, it's important for you to have the right mindset. It's hones you in when it comes to treatment. It brings the family together when it comes to treatment. If everybody is contributing their own parts, if you can't contribute financially, you're praying for your sibling, you're giving words of encouragement. All of these are important when it comes to treatment in pediatric cancer.
Well, there's a whole lot of grounds to cover, but this is where you both of you can just take a stab at this final question as we close up the conversation this morning. Let's look at prevention now and see what we as adults, parents, can do to save our children from being exposed to cancer. Let's look at it. Let's play back time and see. Before, in the days of old, before we got to this age of computers, mobile phones, bringing a child as early as 6 months knows what hello is and can cry for you to get the phone, cry for the phone, and then puts around the ear to say hello. Have you ever explored in this area in medicine to see if we're exposing children to some certain elements that their tissues are too soft for, that could be responsible in a way? What if you can take a stab at it?
So when it comes to radiation from mobile phones, I wouldn't say there's a lot of research there.
I just mentioned mobile phone, so yes. I'm just saying.
There are a lot of risk factors when it comes to somebody having cancer. Radiation is one of it. In women who are pregnant, we try to limit the amount of radiation they're exposed to when it comes to X-rays or CT scans, or rather opt for MRIs or other things. Even a particular imaging modality, the PET scan, if you're going to do it, there are particular precautions when it comes to women. There are shields, radiation shields that they give them to cover the belly. So all these things are things that we can do in prevention. Apart from exposure to radiation, alcohol intake during pregnancy, smoking during pregnancy, not having your proper antenatal visits during pregnancy. There are things that can be picked up really early, because that's the key to prevention here when it comes to pediatric cancers. Early diagnosis. If it is picked up really early at the early stage, chances are really favorable. It's picked up, you see the right people at the right time. Chances here of survival are really favorable. So it's prevention starts even before the child is conceived. Do the right things. Take your folic acid supplementation for the child to grow up well, to prevent as much as possible, limit the amount of genetic aberrations that can occur. And then even in the phase when symptoms have been seen, go to the doctors early and then present early and treatment starts.
Akindele, you'd have to come on this one. Now, quickly, you wrap this up, but also because I picked up something to throw into the question, genetics. So, what have you? There's been this fear of the fact that we eat a lot of not natural food lately. Have you thought about that? Could there be a fear around that area?
No, don't be afraid. Don't link. We can't link that to it. We can't link what we eat to childhood cancer, like you say. Yeah, genetics. That is, it talks about. Like, is a doctor. We read it, and 50%. That's it. But I just want to wrap it up with this information to every parent that has a girl child. Between the age of 9 and 14 right now. So there is an HPV vaccine that the government of Nigeria has released for every child to prevent cervical cancer. It's a breakthrough for us in Nigeria. And so I want to encourage everyone listening to me. You have someone around you that has a child, a girl child, between the age of 9 to 14 years. Please, from the 25th of September, so there's a 5-day rollout.
Yes.
There's a primary health care closer to you, schools, religious center. Please encourage your child. We are saving children, adults, women from cervical cancer. So I think
that's a wrap on the show this morning. It's been a very enlightening moment I spent with these two doctors, but everywhere they say if you're friends with 2 billionaires or 5, you become the 6th. If you're friends with 2 doctors, maybe I become the 3rd, but I'm just saying, but thanks. It's been a wonderful time. Thanks to Dr. Adeola Maliki for your time today.
Thank you.
And I say thank you to Dr. Korede Akindele for also shedding light on the issues today.
Thank you so much. Thank you so much.
And finally, just throw this one in. You can think about it because they mentioned early detection. I remember a Nigerian doctor somewhere in the US spotted a tumor in a baby that was still growing in the womb, brought out the baby, took out the tumor, sent the baby back into the womb, and the child was delivered and was very, very healthy. So it's a wrap, guys. My name is Omatseye Atsenuwa. Good morning.